Aquí estás live y aquí también ya estamos live.
Hey guys, welcome to Tuesday Tips with Dr. Vidal here at Pure Plastic Surgery. Thank you for joining. This is our weekly check-in to discuss different topics in plastic surgery and answer your questions. And today we have a very special Tuesday Tips because I'm going to dedicate the 30 minutes to answering your questions. Thank you so much to everyone that put in their questions in the box that I put in earlier today in my stories. So we have all of those that I'll go over with you guys. And also, I'll take some through the comments like we always do. So if you don't have time to type it in the box, don't worry. We can get it through also later on, okay? I just wanted to mention a few things before starting. The first question is not a question because it wasn't directly placed in one of the boxes, but it's a common question I see in the Facebook group, and it's also a common concern and worry for patients post-op on mommy makeovers, okay? So I wanted to discuss a little bit about that, which is one is spitting sutures, and two is the triple point opening. Those two things are very common after mommy makeovers or breast procedures. Nothing to be worried about or concerned, and I wanted to discuss a little bit about it. So let's start with the first one, which is spitting sutures. Spitting sutures, it's a very common thing that happens. It usually does happen a couple of weeks after surgery, so you're not going to see it right away. You'll see it maybe 2-3 weeks after surgery is when you'll start seeing it, and it can happen even a few months after surgery. The reason why is, you see that I don't put any permanent stitching on the outside of their skin to minimize the scars. But all the stitches are placed inside, which are absorbable stitches, okay? Those absorbable stitches last at least 6 months. It takes time for the body to absorb them, okay? Sometimes the body's healing process, instead of absorbing it completely, starts to express them out of the wound. It's not an infection, and it's not that your body's rejecting the sutures. It's just a normal process of your body getting rid of that material. Sometimes the body just dissolves it and disappears it, and sometimes takes it out, okay? So nothing to be concerned that you have an infection, that your wounds are gonna open up. It's just a normal process of healing, and you can see it in the tummy tuck scars, in the belly button, in the breast. I have a picture here. This is a picture that one of my patients sent. This is the bottom of the areola, and this is the vertical scar. Sorry, what is this? Okay, this is the vertical scar, and you can see here a little bit of an opening. This is a zoomed in picture, so that little hole looks very big, but it's actually less than a centimeter in size, and you can see the little sutures sticking out. So what you can do is with alcohol, just clean it, and then with a clean tweezers, just grab the suture and pull it. Most of the time that suture is half absorbed by your body. So most of the time you don't even have a knot there, and when you pull it, it comes out completely, okay? Sometimes you feel that it's a little stuck still, just take a small scissor and trim it. That's it. This little hole, the skin will heal in a couple of days. You can put mupirocin or bacitracin or any topical antibiotic ointment just to protect it, just to moisturize it until your body heals it and closes out, and that's it, okay? Sometimes you can see it like this, which is a little opening, and sometimes you just can feel it. When you pass your finger through the incision, you start to feel something that it's poking, and it's probably a suture trying to come out. If you just let it heal, like leave it alone, in a couple of days, you may see the stitch like sticking out, and that's when you can grab it with one of the tweezers and pull it, okay? Again, not an infection, nothing to be worried about, very common that happens, okay? The second thing I wanted to discuss was the triple point opening. And then where the two incisions meet, in the vertical and the transverse on a breast lift incision, anchor type, the two incisions meeting down there is an area where the tension relies, and an area prone to have openings and wound healing problems. Again, this is something that usually happens 2 to 3 weeks down the line, and you can see it like this, a small opening in that area, okay? Once it happens, again, take a picture, send it through Clara, and we'll take a look. It's treated same way, an antibiotic ointment called Silvadene, gauze changes twice a day, and then it takes a couple of weeks to heal. It usually heals on its own, and that's it. What you can see in the center of the wound is very common. That white tissue that forms in the center of an open wound is usually not pus. The first thing people think when they see white in a wound is pus, infection. Most of the time, and you can see the rest of the skin is not red, it's not inflamed, it's just very dry, and that white thick tissue in the center of the wound, that's called fibrin. It's our body's way of trying to heal a wound. So the process goes, the body starts to develop this tissue called fibrin that's like whitish, sometimes it's a little bit yellow, it's a little bit not fluid, but a little bit thick, okay? And then surrounding that, you see that pink healthy tissue that's called granulation tissue. So the process of the wound healing will go with that cream that I'm gonna send you. That white stuff is gonna start to dissolve and to go away, and the wound is gonna turn everything into pink. That's the granulation tissue. That's healthy tissue that your body is kind of bringing in to heal it. And the edges of the wound will start to contract. That's why it's a slow process. It takes several weeks for everything to heal and close down. But usually it's not infected, usually nothing to be concerned about, just local care. Takes a couple of weeks to heal, like I said, but usually heals on its own, okay? So those two things, if you see them on the post-op course, just communicate through us, through Clara. That's the best way. With pictures, send it to us. We'll right away get back to you with instructions on how to take care of. But it's, again, especially this, at least a third of patients that go on to have breast lifts, especially breast lifts with implants, because of the tension of the implant, develop these little wounds in that area. All of them heal without any additional complications, so nothing to be concerned about, okay? So I hope these two little things helped out, relieve some of the anxiety some patients have after mommy makeover, seeing those little things of a couple of weeks in, thinking that everything was healed, and then they start to see those little things and get the anxiety level starts to rise. So hopefully that helps with that, okay? And I'll start taking some of the questions that we had in the box.
Okay, so do you use Exparel?
Exparel is a medication that it's a type of local anesthetic that lasts longer in the body. Okay, it's the way that it's made, so your body metabolizes it longer. Okay, so Exparel, I do use it with tummy tucks. It is an extra added cost because the medication is expensive, and it's an extra added cost for us. So it is an addition that you can add to the mommy makeovers or tummy tucks. So it depends. So check your quote. Sometimes the coordinator may add it as a bundle. Sometimes they don't. So just check your quote. But it is an option for the tummy tuck and mommy makeover surgeries. I put it in the muscle to numb the muscle, because of the muscle repair, and also on the incision of the tummy tuck. That medication numbs the area for up to 72 hours. So the first 3 days after surgery, it helps, which are the most painful, helps a lot with the pain control. You can see that patients require less narcotics, and they have a better control of their pain. The reason I do not use it in liposuction or BBL procedures, it's because the amount of product needed to numb all the torso is just too much, and then we end up having problems with toxicity or medication doses that are too high, okay? So that's why I leave it to the tummy tucks, which then we put it on the muscle and also in the incision.
Okay, the second question is, do you do drainless tummy tucks?
So I do not. Drainless tummy tucks are done by some surgeons. They put a lot of stitches on the inside to kind of bring the skin down and attach it. I've done it in training, and by doing it in training, I didn't like the results. The results mainly it's because sometimes it indents the skin when you're putting those stitches on the inside and may cause contour irregularities. So I didn't like those stitches on the inside. The other way that some surgeons do drainless tummy tucks is because then they see their patients every 2 to 3 days and drain seromas. So they poke your abdomen and drain the fluid. I think that is even more traumatic than just put 2 drains and let the fluid just drain itself on the little bulbs, and in 1 to 3 weeks we can remove them. So the 2 ways that people do the drainless tummy tucks, it sounds very appealing and very nice. Obviously I would love to do a tummy tuck without drains, but the way of doing it is the one that I don't really like. So I prefer to put the 2 drains. 1 to 3 weeks, we remove them. The rate of seroma is very, very low. The rate of needing me to put a needle and drain any fluid is very low. And the contour irregularities or the deformities are non-existent because I don't put those stitches in.
Okay, the third question is, how long those BBL last?
So that is a very good question. It's actually forever. So a BBL is basically moving fat from your body, your fat, from one area to the other, okay? So those first 3 months, once that fat is stable and whatever amount of fat it survives, so usually the amount of fat we transfer to the buttock, usually like an 80 to 70% is the one that stays. You lose 20 to 30% of that fat because in the process we need to form new blood vessels, right? That fat that we're moving from one area to the other needs to survive by bringing new blood supply. And during that process, you lose some fat, okay? So approximately 20 to 30%. Once that fat, so the 70-80% that did survive in the buttock, that's your fat, okay? So if you lose weight, if you gain weight, it's the same reaction or the same result as if you would lose and gain weight, and what happens to your belly fat increases and decreases. So it's the same but in your buttock, okay? So now that's part of your buttock fat. So it's permanent, but it is dependent on your weight, your activity. So it's part of your body now. So the way that you treat your body to maintain your shape and maintain your health is the same that you need to maintain your results in your BBL. So keeping a healthy diet, exercising, focusing more on heavy weights rather than cardio, because cardio burns more fat. So those are the ways that you try to keep your BBL shape and form longer, but that fat, it's there.
Okay, I think we can mix a couple of questions here because one is here the maximum time you should have the drains or the time you should have them, and if you are out of town, how you can remove the drains, if you can remove them yourself.
Of course. So it's very common that our tummy tuck patients go home either with 1 or 2 drains. Like I said, I put 2 tummy tuck drains, 1 on each corner of the incision. Most of the time on the first follow-up, I'm able to remove 1, but sometimes that 1 is still draining a lot and you go home with 2. I like to keep them at least until they're draining less than 25 cc's in a 24-hour period, okay? So all of this we will explain to you in the post-op course. You don't have to be worried about remembering those numbers. We'll say it a bunch of times on your post-op follow-ups, but basically once it's less than that amount, that's when we know that your body is one is not producing that much amount of fluid because it's healing, and two, your body's absorbing that amount of fluid. And that 25 cc's is an amount that your body is able to absorb without accumulating it. So we know that we can remove it safely without the need of creating a seroma or a fluid buildup in your abdomen, right? So once it's that, we can remove. How to remove? Most of my patients are able to remove the drains at home with either a family member, or some patients remove them even themselves, okay? So we have a video and instructions of how to remove the drain. It's very easy. The drain is just held in place by a small suture, a black suture. It's called silk suture. That's holding the drain in place. Basically, you cut this stitch and then open the little tab in the drain so it's not collapsed, it's open, and then you pull the drain. That's it. That's all you need to do. Like I said, most of my patients have either a family member or themselves do it. At 3 weeks post-op, I don't like to leave the drains that long, okay? Because then we have the risk of infection or forming scar tissue around that drain that then you can feel it afterwards. So usually by 3 weeks out, the drain is close to 25 if it's not 25, and I like to remove them. I always tell my patients, if you're in that position, send us a picture. And you're back home, you're not here in Miami, you can't come down, just send a picture of your abdomen, send a picture of the drain to see the quality and the color of the drain. And most of the time, I ask you to remove it, and then with massages and compression, we get that fluid to be absorbed by your body.
Okay, what can be done under local anesthesia?
So, I mean, the number of procedures I do under local anesthesia are very limited because I do a lot of body work. And I think that doing either liposuction, BBLs, or breast procedures is just too much, one, for pain, and two, hemodynamically, so on your body physically, to do just under local anesthesia. What procedures we can do? Scar revisions, we can do under local, the dog ear removals, blepharoplasty or eyelid surgery if you're a female and you don't have anxiety and you can stay calm, we usually can do it under local anesthesia as well. And obviously the non-invasive procedures such as Morpheus to the face and neck area, which is radiofrequency energy. We can do fillers, we can do Botox and all of that without the need of a general anesthetic.
Okay, this actually is a live question. So from a patient of ours said,
Yeah.
I had a TT and developed a seroma, got drained all, but I have a bulge. Will the bulge go away? Bulge?
So the best thing to do is communicate through Clara with us, okay? Send us pictures and we can tell you in detail what to expect, okay? Seromas can leave scar tissue in the area where that seroma built up, okay? Usually with massages and later on with other types of non-invasive massaging additions such as cavitation, wood therapy, radiofrequency energy, that scar tissue can improve to the point that it's not visible or noticeable.
Okay, let's go to this one. The C-section. So, how soon after a cesarean delivery would you recommend surgery?
So after a C-section and after a vaginal delivery, I always recommend patients wait at least 6 months, okay? After any procedure, any surgical intervention, you should wait at least 3 months. But with a C-section or vaginal delivery, there are a lot of changes that go in your body, not only just the healing of the C-section scar, but the uterus contracting, your abdomen contracting, your muscle. We don't know how much your muscles are going to retract. We don't know how much your skin is going to bounce back. So there are a lot of things that in your body, we need to give it time to heal, to stabilize, to see what is it that you really need. You may only need liposuction to thin your abdomen, but you may need a tummy tuck to get that muscle repair, that skin excess removed. So the best thing is to wait at least 6 months. But remember, if you're considering doing a breast procedure and you're breastfeeding, you should wait at least 6 months until you finish, after finishing breastfeeding, because it's the same process, right? When you're breastfeeding, your breasts are engorged, they're larger, they're distended, and when you stop breastfeeding and those ducts start to get smaller, your breasts can get deflated, your skin may contract or may sag. So the type of breast procedure to reshape your breast might differ depending on how much your skin and your breast tissue reacts and reshapes, okay? So you might need a lift, with implants, or you might just need an implant to get more volume.
Okay, can you have surgery while on your period?
Yes, you can. I always tell my patients it's an area, so when you come into surgery, it's stress, right? You are under stress, so your menstrual cycle gets all over the place. So it's very common that my patients get here is like, I was supposed to be in my menstrual period a week from now, and all of a sudden, I'm in my period. So don't worry, right? Just be mindful, especially if you have heavy flow, to be on top of your hydration, on top of your supplements, iron supplements, because you're losing blood through the period and also the surgery. It is not a contraindication, you just have to be more on top of your hydration, but nothing to be worried about.
Okay, would you recommend someone to get a mommy makeover after 2 kids if they are unsure of having more?
So that is a very individual and personal question. I always tell my patients, if you are thinking of having another kid in a year or 2, then wait, right? Like you don't want to have a surgery and in a year get pregnant, and your results are going to change after pregnancy, right? Your breast, your belly is going to get stretched out. You might need another muscle repair. You might or might not need, again, skin excision. So your body's going to change, okay? But if you're in a place that you may or may not, and you really don't have a time, and you are focused on getting your shape back, then prioritize what is more important to you, okay? And if you are very self-conscious about your body image, you're trying to avoid, like a lot of my patients avoid even going out, taking pictures, going on vacations because they feel self-conscious about their bodies, then don't stop living and, doing things because the possibility of the future that you don't know. So prioritize what it is more important to you as a person today, but always have in the back of your mind that your results might change if you get pregnant.
Okay, this one. How many procedures can be combined at once?
So it all depends. What procedures, what are we talking about? I think the most common combination that we do that maxes out the number of procedures is 3. It's what Dr. Earl calls the trifecta perfecta, which is the brachioplasty or arm lift combined with a mommy makeover. So breast procedure and tummy tuck, okay? So the 3 procedures, arms, breast, and tummy. I think that's usually the one that it's like maxing out all of the procedures. Whenever I evaluate a patient that wants multiple procedures to decide either how many to do at the same time or how to order them, there are a couple of things that we need to consider. One is the operative time, okay? So remember, I'm doing surgery in an office-based surgery. You're not staying overnight. I'm not monitoring you here like in a hospital. You are going home with a caretaker, okay? So I want to minimize the amount of time you're under anesthesia to minimize complications, okay? So the max amount of time I want you under, it's max 4 hours, usually 3 hours. It's our max time. Maybe if I take a little bit longer, 3.5, 4 hours would be the max amount of time. So if you're wanting to combine a lot of procedures that will extend that operative time to more than 4, and I don't expect you to know the answer to that. That's an answer that you'll get from me from the consultation. I know how long it takes for me to do each procedure. That's one of the reasons I will let you know that it's better to stage it, okay? The other main reason is the limitations that I have here from the Florida Health Department when combining procedures, again, because I'm in an office-based procedure for safety reasons, right? If I'm doing liposuction only procedure, not an incisional procedure, not an open procedure, I can remove 4 liters of fat. So by that, we can combine, depending on your BMI and the areas that you want to target, different areas of liposuction, maybe a lipo 360 with arms, with thighs, with shin lipo, and all of that, right? And that, the decision will be made depending on your BMI, your evaluation, when I see your pictures, when I see your past medical history and all that. So that's why the consultation is so important, because that's when I can tell you in detail if I can combine or not certain procedures, okay? And when I'm combining the procedures with an open procedure, like a tummy tuck or a breast procedure, the limit of liposuction is 1 liter. So again, that's gonna depend on what areas we can combine. Usually, like for example, if I'm doing a breast lift or a tummy tuck, mommy makeover procedure, we can add, for example, arm liposuction, because the arms is not an area that usually we are going to get more than 1 liter of fat from there. It's usually less. So combination of lipo to the flanks with arm lipo usually is okay to combine. Or shin lipo, because the amount of liposuction in the shin is not very much. So it all depends on operative time and also the amount of fat we can combine from each procedure.
If the law is 4 liters of fat at once, is that combined with a TT, or is that pertaining to lipo only?
So there are 2 classifications here, right? Incisional procedures are procedures that require an open incision, and liposuction procedures, right? When we're combining liposuction with an incision, either a tummy tuck, arm lift, breast, any procedure that requires incisions, then the limit is 1 liter. If we're only doing liposuction, not with an incision, just lipo 360, arm lipo, for example, a BBL, then the limit is 4 liters.
Okay, and let's talk a little bit about the use of the faja, because we have a lot of question about that. So
Okay.
how long they will use the faja, when can start using less and more?
Okay, so compression after liposuction BBL procedure, so I'll group them together because a BBL procedure is basically a liposuction 360 with the fat transfer part, but the post-op course of the lipo 360 and BBL is very similar regarding the compression. Compression is extremely important. So there are 3 things that are super important in your post-op results. 1 is compression, 2 is massages, and 3 is time, okay? Letting your skin heal and your swelling to come down. So compression, you're gonna wake up with the compression already on. There are 2 stages. Some people say there are 3 stages on the fajas, but let's say just keep it simple and let's divide it in 2. 1 is the early compression that you're gonna wake up with, and the one that you're gonna wear for the first 7 to 10 days. That's the stage 1, okay? So the stage 1, it's basically a low compression garment, okay? The point is to compress the skin so you don't have, so you control the swelling and the fluid buildup, but the compression is not that much that we can cause problems with blood supply, okay? That turns into lipoburns or wounds in the skin because the skin basically doesn't have blood supply, okay? The reason for it is because the skin is already traumatized from the liposuction, so we need to give it time to heal. Approximately 7 to 10 days. It all depends, okay? Then 7 to 10 days in, we can switch to the stage 2. Stage 2, high compression, okay? So the point of that is limit swelling, limit the amount of creases, folds, and getting that skin to contract as much as possible, okay? So you're gonna use the faja 24/7, the first 7 to 10 days, stage 1, then the stage 2 for 6 weeks, okay? Under the faja, you're gonna wear the foams. What's the foams? What they're for? Basically, the foams help with the swelling and to protect your skin, okay? The faja may create creases and areas of divots in the skin. The foams try to even that out to prevent those creases of becoming permanent. If the creases, you don't put a foam to protect your skin and the faja is creating a crease over and over that area, that crease may become permanent, okay? So the foams are there to help with the swelling and protect those areas of creases. So you want to wear the foams 24/7 for the first 6 weeks. At 6 weeks, then you can go down to 12 hours a day and you can stop using the foams, because at this point, the swelling is significantly lower. So you don't have to worry about the creases because that swelling is not there. It's more of keeping this compression so the skin continues to contract in that shape, okay? So that you're gonna wear for the after 6 weeks, for the next couple of weeks until you're 3 months post-op. And at 3 months post-op, you can start wearing compression. That's up to you. There are some patients that then feel comfortable. They've been wearing it for 3 months. They feel more comfortable with the garment and you can just continue to wear it. But at that point, it's up to you.
So we finished.
That's it. Oh my God. Thank you so much for joining. I love the questions. I think those questions are very good and are going to be very helpful for all the patients considering surgery, because there are questions that are usually shared by all the patients that are coming. So don't feel alone that you're having these questions. These are questions that I answer pretty much to all my pre-op patients that I'm evaluating, because they're common areas of concern. So hopefully this video will help you guys answer all of these common questions. Thank you so much for joining. Thank you so much for the questions. And I'll see you next week on Tuesday Tips with Dr. Vidal.